The hospital was buzzing with activity nurses rushing between patients, doctors making their rounds, and the steady hum of monitors filling the air. But in one particular room, something was about to happen that no one would forget. A well-respected doctor known for his arrogance stood before a black nurse, his voice dripping with condescension. "Maybe nursing just is not for you," he scoffed, shaking his head. "You should leave the real medical work to the professionals." The nurse? She said nothing. She just held her ground, calm and steady. Because what the doctor did not know, the patient watching this unfold was the one person who could end his career with a single phone call. And in a matter of minutes, everything was about to change. Hospitals are meant to be places of healing, compassion, and teamwork. Doctors and nurses are supposed to work together, united by one goal: saving lives. But not everyone sees it that way. Dr. Ethan Reynolds was a man who valued power over teamwork, ego over respect. To him, nurses were just assistants, people to do the grunt work while he took all the credit. And today, he had decided to humiliate Nurse Olivia Carter in front of a patient. He thought she was powerless. He thought he was untouchable. But what he did not realize, the patient listening to every word was about to teach him the lesson of a lifetime. Before we go any further, subscribe to the channel and comment below where you are watching from. The tension in room 307 was thick enough to cut with a scalpel. Nurse Olivia Carter stood calmly, clipboard in hand, while Dr. Ethan Reynolds paced beside her, an air of superiority radiating off him. The poscienta middle-aged man in a neatly pressed hospital gown watched the exchange silently. And that was exactly why Dr. Reynolds did not think twice about what he was about to say. "I do not know why you are still working here, Carter," Reynolds said, shaking his head as he scribbled something onto the patient's chart. "I asked for a blood test 20 minutes ago. Do you have trouble following basic instructions?" Olivia inhaled slowly. She had done the test the moment he asked. She had already uploaded the results to his system, but she knew better than to argue. Because Dr. Reynolds? He did not correct his own mistakes. He just blamed others. So instead, she spoke evenly. "The results are already in the system, doctor. You may not have checked yet." His eyes flicked up, sharp and cold. "Oh. So now you are questioning how I do my job?" A slow smirk pulled at his lips. "You nurses think you know more than doctors these days. Maybe if you focused more on taking orders and less on acting like you belong in this profession, patients would not have to wait." The patient's eyebrows lifted. Olivia? She kept her face neutral, because she had heard it all before. The condescending remarks, the whispers behind her back, the way doctors like Reynolds dismissed her intelligence before she even opened her mouth. But today, she was done letting it slide. She straightened. "With all due respect, doctor, the patient's care is my priority. And that means making sure every detail is double-checked, even when you miss something." The room went silent. Reynolds' eyes darkened. And the patient? Shifted slightly in bed. Something about the way Olivia spoke calm, unwavering, confident caught his attention. But Reynolds? He was not finished. Reynolds chuckled, shaking his head. "You know what? That attitude is exactly why nurses do not get respected. You do not know your place. You should be grateful you even have this job." The patient's expression darkened. But Reynolds? He did not notice. "You think you are so smart? Fine. What is the correct dosage for an 80-year-old diabetic patient with a history of hypertension and kidney disease who just had surgery?" Olivia blinked once. Then, without hesitation, that would depend on their specific lab results, but in general, insulin dosage would need to be carefully reduced due to compromised kidney function. Blood pressure medications would have to be adjusted to avoid hypotension post-surgery. And pain management would require non-opioid alternatives to avoid complications with kidney metabolism. Silence. Reynolds' smirk faltered. The patient, now fully alert, watched them both closely. And then, he spoke. "Well, that was impressive." Reynolds turned sharply, as if he had just remembered the patient was even there. Asterisk. "I am sorry, sir," Reynolds started. But the man held up a hand. "Number, I have heard enough." His eyes locked on to Olivia. "Miss Carter, you seem highly knowledgeable. I appreciate the care you have shown. Then, slowly, he turned to Reynolds. Dr. Reynolds, do you know who I am? Reynolds blinked. Sir? The man smiled, but there was no warmth in it. I am the chairman of this hospital's board. Reynolds went pale. Olivia stayed perfectly still. And that was when everything changed. Dr. Ethan Reynolds' confident smirk vanished in an instant. The chairman of the hospital's board? Here? Watching everything? His mind raced, scrambling for a way to recover. Sir, he started. But the older man raised a hand, silencing him immediately. The room, which had been thick with tension, now felt twice as suffocating, but this time, it was Reynolds who was trapped. And Olivia? For the first time, she saw something new in the doctor's eyes. Fear. The patient, Mr. William Harrington III, was not just any hospital board member. He was the most powerful person in the building. The one who made the final decisions. The one who had the authority to fire people with a single sentence. And the one Reynolds had just humiliated Olivia in front of. The doctor's throat went dry. He had thought this was just another patient, someone who would never question him, never challenge him. But now, everything was crumbling. Mr. Harrington sat up a little straighter in his hospital bed, his sharp, intelligent eyes scanning Reynolds like a predator watching its prey. Dr. Reynolds, he said, his tone calm but ice cold. I have been sitting in this bed for the past 30 minutes, listening to how you treat your colleagues, and I must say, I am disgusted. Reynolds' hands clenched into fists. Sir, with all due respect, you will listen. The weight of those words slammed down like a gavel in a courtroom. I have spent years funding this hospital, ensuring we hire the best professionals, people who value teamwork, respect, and patient care. And yet, here I am, watching a senior doctor degrade a skilled, hard-working nurse, as if she were beneath him. Reynolds' mouth opened and closed, but no words came out. Because what could he say? The damage was done. And Olivia? She stood still, unwavering, waiting, because she knew this was justice. For years, Olivia had endured the disrespect, the condescending comments, the blatant dismissal of her skills. But today, she had witnesses. She had the truth on her side, and she was not going to stay silent. She took a deep breath, turning toward Mr. Harrington. Sir, I appreciate your words, but this is not the first time something like this has happened, and if it continues, it will not be the last. Harrington's sharp eyes locked onto her. Has he treated you like this before? Reynolds snapped his head toward her. Carter, do not. Let her speak. Harrington interrupted, his tone final. Olivia did not hesitate. Yes, sir. And not just me. He has disrespected other nurses. He disregards their input, dismisses their concerns, and humiliates them in front of patients. He treats us as if we do not matter. Harrington exhaled, slowly, his fingers tapping against his hospital blanket. Then he turned to Reynolds. Tell me, doctor, what is it exactly that makes you think you are superior? Reynolds bristled, struggling to maintain his composure. Sir, I want an answer. Reynolds' jaw tightened. The silence stretched, and the longer it lasted, the more obvious it became. There was no answer, because Reynolds knew deep down that he had no justification. He had treated Olivia as less than simply because he could. And now, that power was gone. Harrington let out a slow, disappointed sigh. Dr. Reynolds, your medical expertise may be strong, but your character? It is severely lacking. And in this hospital, that is unacceptable. The blood drained from Reynolds' face. Sir, please. I have worked here for 10 years. I am one of your best doctors. Harrington tilted his head. A good doctor is not just about skill, Reynolds. It is about respect. And after what I witnessed today, I do not believe you deserve to work here. The words hit like a bullet. Olivia's eyes widened. The room felt electrified. You are firing me? Reynolds stammered. No, Harrington corrected. I am giving you the opportunity to resign. Because if you do not, I will make sure you never practice medicine in this state again. Silence. Pure, suffocating silence. Reynolds looked at Olivia, the same woman he had mocked, belittled, disrespected. And now, she was the one standing tall. With a deep breath, she met his gaze. "You always told me I should know my place, doctor," she said. "Looks like you finally found yours." Reynolds had no comeback, because for the first time in his career, he had lost. And Olivia? She had won. Dr. Reynolds walked out of the hospital that very evening's career in ruins. And Olivia? She became more than just a nurse that day. She became a symbol of strength, dignity, and resilience. Because no matter what anyone said, she did belong. She always had. And now, the whole hospital knew it. Respect is earned, not given. Olivia proved that strength comes in many forms sometimes. It is simply standing your ground. If you believe in justice, subscribe for more powerful stories.